Welcome to our short interview series with housing advocates and other folks working to improve the lives of families and help people get ahead. My name is Mike Loftin. I'm the CEO of Homewise in New Mexico, and I'm a non-resident fellow at the Urban Institute. Homewise has been an organization that's worked on increasing access to home ownership for those who have not been able to gain access to home ownership for a very long time. And today we're going to be talking to Arthur Kaufman, who's at the University of New Mexico as the Distinguished Professor of Family and Community Medicine. He's also played a really important role in the creation of University of New Mexico's Health Extension Rural Offices program. The program aims to link the UNM Health Sciences Center programs to resources to rural and underserved communities. Today, we're going to hear from Art about his work in New Mexico and how public health intersects with the need for safe, affordable housing. Art, again, thank you for joining us. You've had a long career in New Mexico focused on community health and have been praised for your innovations, placing medical students in underserved areas. And you've also spearheaded national efforts to address the social determinants that play a pivotal role in health risks and outcomes. Can you tell us more about your work?
Well, some years ago, we were focusing on clinical services and education, but the data kept coming back that the impact of our healthcare delivery system has very small impact on the health of our communities, maybe 10, at the most 20%. But all of these social factors, housing, transportation, income, social inclusion, all of that is like over 60% of what makes us healthy. But we consume 90% of that US healthcare dollar in the healthcare system. Very little goes into any social or prevention services. So for that reason, since we did have the resources, we wanted to know, could we complement what we already do in terms of clinical care, hospitalization, outreach from our clinics, to actually make an impact on all of those social forces. And of course, that's not our wheelhouse. So we had to partner with community organizations in order to learn how do we use our resources and our knowledge to work with those upstream. And we were looking around for how do universities actually decentralize their resources into communities. And the best model we found was agriculture. So agriculture cooperative extension, this goes back to the time of Lincoln, had a model which is called cooperative extension, and it's in every single county in the United States, urban, rural, every place. And every state has a land-grant university, like New Mexico is New Mexico State, and a flagship university, University of New Mexico. And that's true of every state. And so we said, well, let's learn from our partners about how they decentralize their resources. And so we just emulated what they do in agriculture and created not cooperative extension, but health extension. It's really their model, but it allowed us to link communities' health priorities to university resources. Not even just in health, but it could be in architecture and planning, engineering and transportation, educational advancements through College of Education. Many, many resources that every university has, but are not coordinated to respond to what a community's priorities are. So we then screened about 50,000 patients for social needs. We created a little screening tool, and we found that about half of them have at least one adverse social determinant, housing being one of the biggest. And half of those had more than one, some 5 or 6. So we realized we had to reorganize part of our healthcare system to screen for these great needs that had such a big impact, but they were mostly unknown to the clinic because we don't ask these questions. So we put community health workers that are very skillful and work with our community-based health extension agents into those clinics. And so now we have like a network that's able to link with each other in the health system and in the community to try to address these major social determinants. And
So
again,
can you give an example of like, one or two of these kind of social determinants and how that's causing poor health outcomes?
sure. So if you look at, let's take income. That's a big one. The state has a very high percentage of low socioeconomic families, households. It's a wealthy state in terms of oil and gas industry, for example, but that doesn't necessarily translate when you have a very large percentage of the population with not much educational achievement, that are struggling with trying to pay the bills, and they have to make a decision. Do I really go to the emergency room? I can make it $1,000 bill I can't pay, or do I wait? Maybe things will get better. Maybe I'll go to the pharmacy. Maybe they can help me. So in that area, you realize that if your income is low, you have less choices in terms of taking care of your family, buying the right food, getting transportation to your job, paying for gas. My God, it's going up. So you're stuck and you have to make choices between all important decisions you must make. And often health gets put to the back because someone may not have health insurance, or they may have health insurance, but no transportation to get to a facility, other problems. So one of the examples that we worked on is, there is this earned income tax credit that people, even if they don't pay taxes, their income is low, if they are citizens and they work even part-time, are eligible for some support through the federal government with help to get registered for this resource. So we actually applied for a federal government grant, which we got. We're doing it in Bernalillo County, but we can do this all over the state, which is to screen families for eligibility for earned income tax credit. And the average we're able to get the families is $2,500 every year. And sometimes it could be more, sometimes up to $7,000. So we've gotten hundreds and hundreds of $1,000s into people's pockets rather quickly.
Yeah.
That means that they can avoid eviction from housing. They can afford keeping their car, not getting it repossessed. They can buy food. They can get their kids clothes for school. All of those around this one intervention of earned income tax credits, which gets you to the next step where then you can earn more. Now, it may be taking courses that you'd like to take in order for a better paying job. It's just an example.
That's a really good example. And it's something, what's cool about that example is it's an existing program. It's already there. It's just being underutilized because people don't know about it. And so by having your county extension system, essentially, that is talking to people all the time, and helping people get hooked into that is like not an expensive intervention for like a pretty big result.
That's right. There's another example which cuts across many areas. There was a study done recently supported by the Kellogg Foundation and Human Services Department in New Mexico. And it was a study on why is it that so many people who are eligible for many benefits and resources, and the state is very generous with the kinds of benefits people could get, but why weren't they getting these benefits? And there were like 11 reasons. This was done by Dr. Gabe Sanchez with his group. And they found all kinds of barriers. One was stigma. I'm not the kind of person that accepts handouts, and I'm not that kind of a person. Or these are so confusing. I don't know what to apply for. Or, gee, if I get this benefit, am I going to lose those other benefits? Or I'm Native American, I'm getting benefits, resources from Indian Health. Am I eligible for anything outside Indian Health? On and on. So that they gave us a grant to study this and try to intervene. How do we disseminate knowledge and give people the confidence that they can apply for these benefits? Because if you add up all of these benefits that people are actually eligible for, it would, in New Mexico, would be equivalent to a guaranteed annual income,
Right.
with the very positive impacts that has: housing, transportation, food, education, income, all of it. So that's why we're looking at something that isn't just one particular need, but what kinds of interventions would allow people to have access to all of these needs, each family having a different mix perhaps, and giving them the tools and resources where they can access themselves.
Right. And what you're doing is helping people navigate that complexity so they can
Exactly.
access stuff. So what about, can you think of like you mentioned earlier that housing and access to housing is a significant social determinant of health. Can you give an example on the housing front?
Well, there's so many experts out there like yourself. I'll just, I'd rather talk about how we as a healthcare system came to realize, wait a minute, we're not experts, but we have resources that we can give, intellectual, financial. We were working on a problem of recidivism, of returning citizens in and out of the jail system, the county jail system, which is very, very expensive for the county. So the question is, how do you decrease kind of readmissions into that, or rearrests into the county jail? And many of the reasons for that are these social forces. You couldn't find a job, you didn't have transportation, there was no income coming in, you were breaking parole, many, many reasons. So we went and we actually interviewed mostly women in the Bernalillo County Jail. And so many are arrested for substance abuse, stealing drugs. Where are you going to get income? It may be, for many people, the fastest way to get some income to pay for your needs. And one of the things they said, I'll never forget, and it was one of our community health workers that reported this back to us. They said, we need housing. If we don't have housing, living on the street is so painful. First of all, you're sleeping on concrete. You can be attacked. You're trying to protect yourself. It is really painful. And so to numb the pain, social, physical pain, emotional pain, if you're on drugs, at least it numbs it for a while.
Right.
I had never heard that, the correlation before,
Right.
but it made a lot of sense to us. And that's why the idea of housing first makes a lot of sense to us.
Right. Right.
The university is therefore very interested in supporting, for example, shelters. Now, the mayor said, he would like all health systems to contribute. And so we jumped into it, and, we provided social services to the big West Side shelter, but also to other shelters. And then got very interested in helping with tiny homes. So we're working with that. And then we're working with a group that are looking for safe open spaces. One of the dilemmas is when people don't have resources, or their lifestyle, whether it's addictions or commercial sex work, whatever it may be, means it's very hard to be in a shelter with a guard where you can't go back and forth
Right.
easily. Sometimes living in the street is the only option. If that's the case, which is true for a sizable minority, what is the safe space they can live in? And so we work with a group that is looking at how do you create spaces that have protection. It may be anywhere from tents to more permanent structures. So we're looking at the ways in which the health delivery system in the university can work with different groups, because needs for shelter and housing from temporary to permanent is varied. So that's kind of brought us into the realm of housing, where university, no, this is part of health and social services. We have to get involved.
Right. Now that makes a lot. And you have people in crisis like that who, it's going to be really hard to get out of crisis without stability in housing, and living on the street, right? And so, and I know that there's been a lot of attention on the housing first strategy, which I think is generally accepted now is what makes a lot of sense. One thing I think that in when we think about homelessness is that not very many people are born homeless, right? homelessness finds them. A crisis happens, or something is going on there, right? And people lose their housing, right? Very true in high cost markets. What about, like, if we talk about upstream a little bit, like with people, there's families living in homes but they're precariously housed, right? That they can't afford the rent. They don't have enough income to afford the housing expense. And what you mentioned too is that house income is a major social determinant of health. I mean, I think you could expand that to like discretionary income or lack thereof is a social determinant, right? So housing is, for most people, is people's biggest monthly expense, right?
Right.
And even if what is considered affordable housing expense is 30% of one's gross income. Well, even if you have an affordable rent, that's a significant part of your budget.
That's exactly right.
But many people are cost burdened, right? They're paying over 30% of their income or rent, or severely cost burdened, paying over 50%. So if we're really going to get our arms around preventing homelessness, we need to make housing affordable, right? And that, it seems to me that has a few positive effects. It helps people have more stability in their housing and their living situation. But also, if you stabilize people's biggest monthly expense, housing, their discretionary income increases, just like the tax earned income tax credit
That's
increases
exactly
people's
right.
discretionary income. How would public health folks like yourself and government and nonprofits and stuff who are working to make housing more affordable, what do you see the opportunities to work together? Because that's something I think a lot of housing people who are concerned working on housing see that as a big opportunity, right? It's because what we're not about, usually most housing people are not just about shelter. We're trying to help people get ahead. We're trying to help families improve their lives, and individuals improve their lives, and help homeless people escape homelessness, not just survive it, right? So I think this upward mobility thing is something that's important, I think, to the public health sector, as well as groups advocating for the welfare of children and people advocating for more affordable housing. So what are your thoughts about that? How do all these different sectors work together for that kind of common outcome that we're trying to achieve?
I think that what appeals is, what is the population that kind of plucks on people's heartstrings? Right. Because often the motivation is not, you can show data that it's important. Right. No. What motivates people? What gets them excited? Youth. Often, if you say, well, we really want to care for folks who live in trailer parks. Okay. But if you said, but the kids really don't have any food. Oh, wait a minute. So I think, what is it that motivates people that makes it personal to them? Often it's the fact that pets are being, why? Because these are people, sentient beings that rely on it, right? It moves them. And that's very important in terms of how you build a strategy to get people to feel the importance of this. Because often people feel these are just, get them out of, not in my backyard, just get them out of here, as opposed to, wait a minute, there's a humanity here like me, that I could have been there. So that's first. The second is to look at the different categories. For example, we worked with PIRE, a terrific national evaluation group that just finished a study on homelessness among youth. And by youth, they meant age 15 to 25. They looked at that group. The amount of couch surfing was huge in that group, couch surfing. The number of college students, CNM, UNM, that have no stable housing is huge. Who knew? Thousands. So now you're looking at something you could maybe relate to a little bit. And often these are young people who are escaping a terrible situation in their home. And they're just getting out into the street, into a worse situation. Even couch surfing, it's very unstable because, people will tolerate you for a little bit, or they'll exchange sex for staying there for food, but it doesn't really deal with that underlying problem. But it's hidden because you don't see them all on the street, but they could have been on the street,
Right.
back and forth. So there's a different kind of intervention there. And one of the findings by interviewing lots of young people is that if you ask them what their needs are, it may be different from what everyone else thinks their needs are. To be included in the decisions about their lives. And a lot of it had to do with, it's not just housing. They need a set of social services. That's what we had kind of talked about before. The part of the solution is not just the housing, it's housing first, but you have to have these wraparound screens and interventions for people to take that next step. So I think that's big. The other is, I was very struck by what the mayor did in getting all these big health systems in New Mexico involved in supporting health services in shelters. Just one of many things that took place. But how he did it was, all of you are getting a lot of resources from the state, from the city, and the county. I need you to step up, and I want you to work together and figure out how to provide health services in these shelters. Because right now, without health services, the ambulances keep running out there and bringing people to emergency rooms for thousands of dollars. Could have been prevented if there had been any kind of health screening at the shelter. That was it. And said, by the way, I'm not going to be paying you for this. This is something that's your obligation. So, okay, the mayor says to do that. Well, let's do this. And I think we tend to think of these items as isolated. They're not. So let's take a hospital. What on earth does a hospital have to do with housing? Well, across the country, there are many hospitals as a part of large institutions within an area who are contributing to that. Because without housing, you have the same group readmitted to the emergency room, being hospitalized for preventable conditions at hideous costs that are not repaid to those hospitals. So the city benefits, the county benefits, the hospital benefits. So what I'm driving at is to find solutions that are win-win, not just for the people who are desperately needing this housing service, but all the other organizations that are touched by the fact that you have a large group of people who are housing unstable.
Yeah, no, that makes a lot of sense. I think it's like, part of the problem is everything is so fragmented that connecting those dots and bringing it together where we have a coherent strategy that is a preventative strategy that's going upstream and getting to the root cause of problems makes a lot of sense. So I really appreciate you taking the time today, Art. This has been a great discussion. I want to thank everybody for watching today. We always are interested in your thoughts about this discussion, and we hope you will tune in again next time. Thanks a lot, Art.
Thank you very much.